All right, so I'll introduce myself. I'm Udoka Holinbeck. I'm general dentist, proudly a biological dentist, a holistic dentist. And you know what qualifies me to even, present this to you this evening? Well, I place implants in my office, so that's a start. But I've dedicated my career to continuing education, and the passion behind it is I love to educate and I love to empower people. And so what I learn, I like to share with others, but I've got to learn it first. And it's important because nowadays we've got so much information from all kinds of sources, qualified or not. And I want to be one of those resources that has taken the time to vet the information that she's sharing. So I went to dental school out in Los Angeles. There really isn't a holistic or biological dental academy that exists, at least not in the US that I know of. So I learned everything, conventionally like everyone else. And a few years later in my career, started noticing some things that kind of forced me or challenged me to learn more. Since then, I've received my fellowship from the Academy of General Dentistry and my accreditation from the IAOMT. All right. And then, when I'm not doing dental related stuff, I get to hang out with this beautiful crew here. My husband and my two boys and my little girl. And, they kind of give me my purpose and make everything worth it. So I'm really blessed to have a partner that's supportive and kids that are just adorable little terrors, but they're so great. All right. All right, so metal-free dentistry. This is an article from that I wrote into the Delafield, local magazine. And the reason that this topic is relevant, we talk about things that aren't relevant, but metal-free dentistry is here, and not just implants. Even before this, we've seen this shift in dentistry from metal to metal-free alternatives. And, we see it in our fillings. You don't even have to be a holistic, quote unquote, dentist to not really be placing metals. It's hard to justify a place for them. I mean, everyone's got their own opinion, but I've never had to place them. There are so many alternatives that have no metal in them. So in our fillings, we're seeing, more and more not using metal. In crowns, we really don't use metal in crowns a lot. I mean, there are a few indications, but really you can get by a lot of it without using metal. Even in the partial dentures, there used to be this cast framework that, the denture teeth would sit on top of, but now we use a lot of flex partial denture material. Even in orthodontics, yes, there's absolutely a place, for the traditional bracket and wires, but, even with that, a lot of patients are asking for that ceramic or metal-free brackets. They are also Invisalign, clear aligner therapy, and the whole slew of that whole entire industry is metal-free. So it really shouldn't be surprising that, people are asking and demanding for metal-free dental implants. And I think that, it's been kind of the standard of care in other countries. Continent of Europe has kind of been our gold standard, at least, when I'm learning. The experts kind of are coming from Switzerland and places over there. But we're starting to see that become more and more commonplace here in the United States. So it's really, really exciting. So before we get into all of the details, let's first start by defining what a dental implant is. Essentially, what we're doing with a dental implant is replacing a tooth. So in order to receive an implant, you have to have a tooth that's missing, gone, the whole thing being gone. And what that's going to do, that implant it's a fixture that is secured inside your bone. And as you can see in the schematic here, the fixture is in the bone, and that is intended to replicate the tooth root that's inside the bone. And so just because you have that implant doesn't mean like you're done. You still have to place a restoration on top of it. So you still need that top part of that implant, the part that actually mimics the tooth. So replacing a tooth in an implant is a multifaceted process. But you can see from this image here, this illustration here, that the tooth crown, the natural part that you see, is ultimately, the goal, the restoration that you want to place on top of the implant. Now, if you're missing more than one tooth, then you've got a whole slew of options from, basic one tooth crown to bridge, implant supported bridge, to hybrid prostheses and dentures that are secured with implants. But for the purpose of simplicity, I'm going to talk simply about an implant supported single tooth restoration. All right, so whenever I have a consultation with a patient and I'm giving them the option or talking about how we do implants in the office, I always start by letting them know what their other options are. So in a little bit, I'll talk to you about that. But I say you've got 3 main options to replacing your teeth, 4 if you count the option to do nothing. And that's always an option. But there are some consequences to doing nothing. And as you can see in this picture here, a few things start to happen when a tooth is missing. First and foremost, the bone loss. When the tooth is gone, the bone really doesn't have a job. It stops engaging. And so we see that bone loss, not just in that area where the tooth is missing, but we see that bone loss starting to affect the adjacent teeth as well. So, in the human body, in the mouth, no one organ stands alone. So with the teeth, the same is true. If something's happening on one tooth, it is going to affect things on either side there. And so that's the challenge we see when teeth are missing. The adjacent teeth start to lose bone. Additionally, when you think about it from a functional, from a mechanical, purely mechanical standpoint, when a tooth is missing, now those adjacent teeth they've got more work to do. Right? And so it makes them weaker, and it lessens their likelihood of lasting your whole life, especially if your bite is anywhere outside of ideal. And then again, that brings me to another consequence, which is changing of the bite. The teeth are gonna start to shift. They're gonna start to go to places, they're gonna follow the space. And that's the beauty behind orthodontics. Teeth like to shift and move where there's space. And so when a tooth is missing, you'll see the top tooth kind of drift down into that space. The adjacent teeth will start tipping over. And that really puts stress on your bite. It makes the forces that you're applying to your teeth uneven, and it makes those forces traumatic. So you're dealing with teeth now that have lost their partner, their neighbor. They've lost bone. They're now doing more work than they were designed to do. And now they're doing that work in the wrong position because they're torqued, they're leaning, they're rotated, and they're getting trauma. So it stands to reason that when you lose one tooth, because of all the other consequences, you tend to end up losing another and another and another. And it can be a snowball effect. And so, not to catastrophize things, but there really is a true consequence to losing a tooth. And then on top of all of that, there's the aesthetics of it, especially if, we're not talking a back tooth. If we're talking about anything in the aesthetic zone, it doesn't look good when the teeth are missing. All right, so taking that concept of bone loss one step further, this image here shows a woman and her jaw and how it collapses as bone resorbs over time. So this is an exaggeration because, it's rare to go from all of your teeth to none of your teeth, but it does illustrate the point. And I've had lots of patients tell me, even after losing one tooth, I don't like that sunken in look that my jaw is taking at this point. And when there's nothing in there to engage the bone, it will resorb. Okay, so yes, you've got the option to do nothing. And sometimes nothing is the best thing to do. If we're talking about third molars and second molars, yeah, it doesn't always make sense to place implants back there. But most of the time it is necessary to replace a tooth when it's missing. So if you do decide that you want to do something, here are the three options that you have. You've got the removable partial denture, which I would say is probably the simplest, most economical solution. The turnaround time is really fast, where it's not invasive at all. We essentially take a mold or a scan in our office, and we help the lab with designing what that partial will be. And then essentially it's going to replace all of your teeth. And this is a great, interim solution, because when you have a partial denture, any kind of prosthesis that just sits on the soft tissue, you don't ever get the same chewing forces or chewing torque. It doesn't ever feel like your natural tooth did. So the big downside to the removable partial denture is the function is not nearly the same. And if anything, that friction from that partial does actually cause that bone to resorb even more. But if you're looking for something that's pretty straightforward, kind of, okay, I need to buy myself some time until I'm ready for that implant, then this makes sense. But rarely do I find someone who says, oh, I really love my partial. It feels great. I can chew well. You've got to take it out every night. You got to soak it. Every time you eat, food gets underneath it, so you've got to rinse. So there's a decent amount of maintenance there. So the second option is a fixed bridge. So I'd say a fixed bridge is a lot more definitive than a removable partial denture. It's fixed, so it's glued in your mouth. There's no need or even ability to take it out or mess with it in any kind of way. It's, creating that is straightforward. The teeth get shaped, scan goes to the lab, and then that design gets made. And then a few weeks later, you should have your bridge. But the downsides there are a few. One, which is probably the most critical, is in order to do a fixed bridge, we do have to shape the adjacent teeth, the teeth that are on either side of that space. And this is a consequence because, if these teeth don't need any treatment, and we're talking about teeth that are otherwise healthy, it is a big shame to end up losing that much tooth structure. The other challenge is maintenance, kind of getting underneath there and flossing. You're not able to floss those three connected teeth the way you would your other teeth. So it's not impossible and it's not difficult at all, but it does add an extra bit of maintenance there, right? So the fixed bridge, if someone goes with a fixed bridge, there's nothing wrong with it. But the challenge here is that it doesn't engage the bone. It doesn't solve that problem of bone loss. And then we've got the dental implant. So the dental implant is ideal. It really is the only thing that we have in dentistry that most closely mimics a tooth. And so it's a really ideal way to replace a tooth, assuming that all of the correct parameters are in place. There's no need to touch the adjacent teeth. You really can replace a single tooth independently of all of the other teeth. Maintenance is similar to what you would with your natural teeth. You're flossing the same, brushing the same. There's no taking it out after lunch or anything like that. The downside to the dental implant is it can be a lot more time consuming, and it is a greater financial investment. So we're essentially looking to replace something like extremely long term. So that can take time to do, and it can take more financial investment to do that. Once the tooth is removed, there's a period of time where that bone has to heal. Then the implant goes in, and there's a period of time where that has to heal, and then the crown. So sometimes it can take several months to a year even. Okay? So those are your main options there. This presentation is about dental implants, so that's what we're going to talk about. All right, so let's say you're considering a dental implant. Well, for me as a practitioner, I'm thinking, is this person and is this scenario appropriate? Are you a good candidate for an implant? So the first thing that we want to look at is your medical history. There are some things that do make placing implants or implant success challenging. If someone's a smoker, that is an oral environment that's not really conducive for not many things, especially an implant that really needs the ideal healthy site to heal. Uncontrolled diabetes can be another one there, and bisphosphonate use. Bisphosphonates have been prescribed for some time now to treat osteoporosis, and essentially what happens is it changes the way the bone turnover process goes, and it does lead to necrosis of the bone, so bone death in the presence of surgery. So that tends to be one of those things that can make someone not a good candidate for an implant. But for the most part, if you're healthy, or even if you have underlying conditions that are managed, implants are pretty well universally tolerated. The other thing that I'm looking at is the anatomy. We've got to place this implant in bone, so there needs to be bone there. And if there's not bone there, how do we get bone there? Is it possible to get bone into that site? Also, anatomically speaking, we've got to avoid certain things too. There are certain nerves in certain positions, sinus spaces too, that we don't want to impose on. So anatomically, we've got to evaluate that and figure out, if this is an appropriate scenario for an implant. And then lastly, I'm looking at compliance. Is this, there's some work that goes into making sure that your mouth is clean, and is this person able to follow the post-operative instructions? Can they make it to their visits? Do they understand appropriate or oral hygiene and all of those things? Okay. All right. So let's say, yes, you are a candidate for dental implants. Now you're at a crossroads because, you've heard about these ceramic implants, but you're not quite sure, but, you're not sure about metal either. Let me kind of lay out to you the two main categories, types of dental implants. So you've got your metal and your metal-free. So a metal implant is made mainly of titanium. And for metal, titanium is a superior metal. So it's not like, dental implants or metal implants are garbage. For a long time, these titanium implants provided many people with an opportunity to replace teeth. But the challenges are, like with anything that's metal, when metal goes into the mouth, which is a moist environment, we deal with a lot of corrosion. A lot of buildup. Plaque and bacteria tend to harbor at the site. We get inflammation a lot around metal implants, and we may see the bone resorbing or receding in those sites. Aesthetics has been a challenge, especially in the anterior spaces, where you can kind of see that gray line in the gum tissue where that implant is seated. And then we're dealing with the concept of biotolerance versus biocompatibility, right? So just because something exists in our body doesn't really mean that our body is, it doesn't mean that it's compatible. Your body could just be tolerating it, and then you end up, it's existing in this level of chronic inflammation. And we're finding that that's the case with a lot of people with metal, implants, whether it's dental or hip or whatever. And then there's a sensitivity and allergy. So the research is showing that about 3 to 4% of the population has a true titanium allergy. The challenge is that there are other trace alloys that can give off from an implant, and 20-something% of people are allergic to nickel and other metals too. So the allergy concern is a pretty valid one as far as metals go, and then you're essentially embedding it into your bone. So that can be a recipe for success if your body does not like this material. Now, the other side of it is metal-free, right? So metal-free implants are made mostly of zirconia. They're obviously more aesthetic because they're white material. But more than the aesthetics, they tend to be so much more tolerated, so much better tolerated by the body. We tend to see the gum tissue just grow over these implants like a fern. A lot of times when I place them and I go back later to place, prosthesis on top, I'm having to kind of shape the gums and remove extra gum tissue. And that's what's so powerful about the zirconia material. It doesn't corrode. Unlike metal, it's not conducting any electrical currents, no galvanic reaction is an issue. And it almost kind of, it repels plaque, right? You could see buildup on someone's teeth, and then you get to the implant and there's just not really any buildup there. So it's just a really, really impressive material, how the body appreciates it. And there isn't a record allergy for zirconia implants. So it tends to be very, very biocompatible. All right, so let's talk a little bit about semantics or definitions, because I've talked about zirconia implants before, and you know that someone will always say, well, isn't zirconia metal? And that's a really, really great question. But zirconia is not a metal. Zirconium is a metal. And you'll find zirconium in the transition metals part of the periodic table. And I'm not going to get into organic chemistry because I've got like some past trauma from all of those classes. But zirconium, when it gets oxidized, changes its structure. And in that new state, it's got no metal properties, which shouldn't really be hard to conceptualize, because there are other things that we do that we change compositions for, right? So zinc is a metal, but then oxidize it, you get the zinc oxide, which we use for sunscreen and diaper rash ointments and things like that. So it's, you know, you can change things organically, and especially with heat and pressure, it's the way we convert sand to glass, for example. So that zirconia does get changed, and it has no metal properties. So zirconia, which is zirconium dioxide, is a ceramic, not a metal. All right, so now let's say we've decided we're going to pursue a metal-free implant in my office. Well, the first thing that I'm going to do, once we've, you know, talked about our options and talked about a good prognosis and you're a good candidate and all of that, we start our digital planning. So the digital planning is really important for me, specifically because I think, I mean, technically you can place an implant anywhere where there's bone, but the challenge comes later when you've got to put that crown on that implant. And if you've not positioned that implant ideally, then you can have some challenges restoring that. So we want the teeth to, you know, the new tooth to line up with the other teeth. We want the bite to line up. Now, sometimes there are challenges with where the bone is. You've got to go where the bone is. But if I can always start with the end goal in mind, I find that I'm a lot more successful when I do that. And I can plan that successfully digitally. So in our office, we'll acquire a digital model, and then we'll take a 3D CBCT scan. And I get to do the fun job of superimposing those things together and essentially measuring and figuring out specifically down to the millimeter where that implant is going to go. What position is it going to be in? What angulation is it going to be in? Right? And so once we figure out the position of that implant, I will create something called a surgical guide. And that's this image here on the lower right. And so the surgical guide takes that digital positioning of that implant and creates something tangible. And it's got a little hold where that implant will go. And it's positioned and oriented the way that it's been planned digitally. So I really love this process because it takes away the guesswork and it increases our precision when we're actually doing the procedure. All right. So on the day that the implant is placed, and it's so funny, patients will tell me all the time, whoa, that was simple. It was nothing. Implant placement tends to be way more straightforward than when you actually have the tooth removed. Much less post-op issues. It's a quicker procedure. And when we're using our digital planning, then we don't have to do a lot of finagling and too much measuring there. All of that is done ahead of time. So on the day of the surgery, we get that implant in position and then we wait. We want to give that implant plenty of time to integrate. And I'll talk a little bit more about that in a moment. One of the things that I couple with implant placement in my office is PRP or PRF therapy. So this is a great biological way to promote healing in that site. Essentially what we're doing is we're drawing your blood and spinning it. And when we spin it, the blood separates into different layers. And so the layer that I'm interested in is called the Buffy coat layer. And in that layer, that's where we've got some leukocytes, some platelets, essentially growth factors and things that are cells that are going to promote healing in that implant site. So I will apply that extracted layer of the blood back into that implant site, and then close it up and allow it to heal. And so that technique has worked really well for me. I think not just promoting healing, but helping to reduce post-op infection. Whenever you do a surgery, the biggest complication is always infection, and knock on wood, wherever it is, very rarely have to prescribe antibiotics. Using PRP therapy, there's a mouthwash also that we use. And then on top of that, we're doing a lot of ozone oxygen therapy. And so that kills the microbes, and it really sets us up for success. And if we can keep that site clean and the body does what the body knows how to do, we tend to see very good, very rich healing. So if you're not aware, I've got another webinar up on ozone oxygen therapy, and this is a really fantastic natural way to disinfect, and it's very potent, and it's made of oxygen. You can't really get more natural than that. The ozone kills the microbes, and then the byproduct is oxygen, which enriches the blood cells. So that is something that's used every time I place an implant. So the implant is placed, and now we wait. There's a process called osseointegration. And this process is really, really important. This is when your bone locks in around that implant, so that your bone really has to favor that material. And we find that in the research is very clear how the osseointegration of zirconia is very comparable, if not better, because of the biocompatibility than titanium. So I think one of the misnomers is, oh, okay, you've got this metal-free implant, but is it gonna stay in my mouth? Oh yeah, it'll definitely stay in your mouth, and the bone tends to love that material. So the integration process takes several months. Depending on what part of the mouth we're dealing with, it can take somewhere between 3 and 6 months. In the upper posterior area, the bone is really soft. I tend to let those implants kind of bake for much longer before we put a tooth on top of it. But we're dealing with something that's designed to stay in the bone indefinitely, right? So what's an extra few months of waiting for your bone to lock around it? So if there's ever a doubt, I just give it extra time. So now, we've set up this site for optimal healing, but one of the things that we want to be aware of is potential failure, right? Your bone failing to lock around this implant. And what are some of the things that can cause that? Obviously, not taking care of that site could cause it. Smoking and some other things could cause it. But we're finding that vitamin D3 is playing such a major, major role in how the implant stays in that bone. And it's playing a role in the quality of the bone that we have as well. And so vitamin D3 deficiency makes you 300 more times, I know, when I read that statistic, I had to read it again, 300 more times likely to have an implant failure. Or no, the statistic was when an implant fails, the correlation is D3, 300%. So we really want to make sure that we're boosting our vitamin D. And here in the Midwest, I think all of us are extremely deficient. So one of the things that I will walk my patients through before we even start the implant process is, where are our levels and do we need to supplement? And a lot of people are already doing some sort of supplement therapy, but getting in there with a good blend of things that are going to help promote healthy bone healing and growth, calcium and vitamin K2 and manganese and magnesium. Those are very important. And there's a particular brand that I'm using in my office that is looking very successful. So setting yourself up for success with these supplements is very good too. And, everything goes well until it doesn't, right? So these implants have a 97, 98% success rate. That's really, really good. But when things don't go great, you want to make sure that you've got a practitioner that really knows this material and has experience and knows how to help you through figuring out what the next steps are. So it's important that your practitioner is local. It's important that this person is easy to reach. I'll typically tell my patients, there's a phone number I'll give them and let them know here are the things that, we could encounter. And if we encounter anything, I'm, right there and available for them to reach. All right, so once the implant is in, then we've got to get a crown on top of it, right? So here's a photo of a case that I did at my office. And these red markings are what's called articulating papers. So I'm really very particular about the bite. I'm always checking someone's bite. And so we don't want our natural teeth, the bite to be off there, but we certainly don't want the bite to be off on our implant. So that's what those markings are. But essentially the photo on the right is the implant with a healing cap on it. And then on the left is the crown. Once I put that crown, secured it onto the implant. So you can see how we can get these contours to look and blend very well if we, plan ahead. It's another case that I did with front tooth. The first picture is with the healing cap, and then you've got that abutment, that kind of, I call it a little top hat, secured on top of it, and then you've got the crown fabricated and secured on top of that. All right, and same with the bottom. You can see actually this photo on the right side. It may not be very significant, but when you've worked with implants for a while, you can tell, the metal ones sometimes when you get that kind of purplish color in the gum tissue. And so it's really neat when you see how pink and thriving the gum tissue is around the zirconia implants. All right, so that's my presentation here. If you have any questions, tape them below. Otherwise, I will check out, and then I will see you guys at the next one. Thank you so much. So I'm getting a question about what supplements we use. The brand is called Dentamedica. And it's got, the appropriate amount of not just D and K, but manganese and all the other things, but it's called Dentamedica. And whenever you're considering supplementing, and I'm such a big fan of the integrative approach, when patients ask me about it, my next question is, all right, are you supplementing already? Let's compare what you've got. We don't want to overdo it, and we don't do it forever either. It's really nice if we're able to start 2 to 4 weeks before the implant is placed and then continue it for a few weeks after, and then you resume whatever your previous supplementing regimen was. And then if you've got a practitioner, I always check with the practitioner just to make sure, hey, I think a lot of times we think, herbs, vitamins, not going to harm anything, but they can change things. And the last thing I want to do if you're working with a practitioner to achieve something and come in and I alter that. So I'm always wanting to know, what are you on? What are you using? And is this going to help? And I certainly don't want to hurt. All right. Very good question. Okay, well, I am going to log off here, and everyone have a fantastic night. Thank you for sharing a few minutes with me.